Dr. Stephen Keister, and he would like to say a few words if we could give him a moment.
I am probably the oldest person here. I came to Erie in 1950 to practice medicine and practiced for 40 years, which was the golden age of medicine in Erie. It was before the insurance companies started telling the doctors what to do. When I came to town, the communication was between the patient and myself. The first visit we spent an hour discussing, examining, and so forth. Then we sat down and the patient and I decided how he would be treated. Unfortunately, at that time, we were not with the insurance companies to give us guidance. Nowadays, the doctor and the patient are secondary to the insurance companies, which are here to make money for their stockholders and their executives. I have friends in Europe who ask the question, how it is in the United States there are 45,000 people a year die from lack of medical care, according to a recent Harvard study. 45,000 people dying without medical care in the richest country in the world. This was not true before the insurance companies began to dictate to the doctors who would be treated and who would not be treated. We were at liberty when I was practicing to make our own decisions. It was for the good of the patient and for our satisfaction. Those days appear to be gone forever. I personally am in favor of universal single-payer health care, which is not socialized medicine. The Physicians for a National Health Care Plan goes back some 30 years, has a membership of 17,000 physicians, and wants medical care for all at a reasonable price. It would not be a government agency. It would be run by a public insurance company. So this idea of socialized medicine is pure and simple hogwash. Under the single-payer plan, everybody would have cable-to-grave insurance. You would choose your own physician, your own dentist, your own hospital, your own pharmacist. There would be no bureaucrats intervening as they are now from the insurance industry. The agency would be set up with some government oversight as regards fraud and so forth, but it would not be a government agency. The only socialized medicine we have in this country at the moment is the VA, where I did fill in for a while after my retirement and where excellent medicine was practiced. If that is socialized medicine, the whole public should have it. Now the matter of single payer is apparently dead. The insurance companies have killed it for the politicians, and I would suggest that anybody interested in political influence who has a computer go to www.opensecrets.org.com and see how much our politicians are being paid by the insurance industry. Witness the one Senate committee, which is yet to report, the Senate Finance Committee. The chairman of that committee has received over $3 million from the insurance companies, and he is opposed to even the president's public option. So don't pay any attention to the Senate Finance Committee as an instrument for giving us government health care. If we do not get the option, which is going to be a difficult fight, I'm afraid, we will revert once again to the insurance companies and the tricks that they have been pulling. For instance, if you are a woman and apply for insurance and have had a cesarean section, the chances are you'll be turned down because that is considered a pre-existing condition when you buy health insurance. Another example of pre-existing conditions, which we see now, is exhibited by the rescission program of the insurance companies. That is, you develop breast cancer, are under treatment, and suddenly say, oops, we can't continue this because in your application for insurance, you did not mention that you had acne when you were a teenager. So you're left hanging. The insurance companies definitely dictate to the doctors what they cannot do. So we have reached a different era. My last experience before I retired at the age of 70, some near 20 years ago, was with a very nice lady in her 60s who had rheumatoid arthritis.